Hello and welcome to another interview at EULA 2026 here in London. My name is Michael Pölzel. I'm a patient representative with EULA Pare from Austria. I'm delighted to have with me today Dr. Kostas Gkikas, who is a lecturer for nutritional science at the King's College of London. Thank you very much for joining us today.
Thank you very much, Michael. Delighted to be here. Thanks for the kind invitation.
Thank you. You have just given a talk on nutrition and inflammation in rheumatic diseases. From a patient point of view, one of the first questions that you always ask is, there are wonder diets, there are supplements, there are pills that we can take to make our diseases better. Can you tell us from a scientific point of view, are these claims true? Can they be backed up, or is there nothing behind them?
Thank you for this question. And this is something that people with rheumatic disorders ask, as you say, so many times in their healthcare professionals: what should I eat to better manage my disease? Is there a specific food that I should be consuming or not consuming to better control my symptoms? Unfortunately, there's no magic pill. So unfortunately, there's no specific elimination diets that are recommended right now for the management of rheumatic diseases. The EULAR guidelines and other guidelines from different organizations, different international organizations, do not recommend adhering to specific exclusion diets. And one of the reasons is that going on these so-called anti-inflammatory diets could potentially have deleterious effects, such as nutritional insufficiencies or even disordered eating. So what we would recommend is to follow a healthy eating balanced diet, such as a Mediterranean diet, which we know has additive benefits, such as a better cardiometabolic risk, protection from cardiometabolic risk outcomes, and also supports an overall better health. I truly believe that people with rheumatic disorders should have the opportunity to discuss these issues with their healthcare professionals. And I think the best way to do that is by speaking with a dietitian or a nutritionist, hopefully someone who's an expert in rheumatic disorders as well.
Thank you. That is really valuable advice that we can pass on. Thank you very much for that. With all the research that is ongoing, do you think there will be a point where we can be more specific with dietary advice for specific diseases or lifestyles, do you think?
Yeah, and this is a great question. And what I showed in today's presentation is that in the last 10 years, the interest in nutrition in rheumatic disorders has increased so much. There's an exponential increase actually in the number of papers published looking at this particular topic. And I do think there's more and more studies out there that are published and are looking at the role of diet as a complementary strategy to medical therapy. There are some trials that are looking at specific diets or supplements as a way of increasing response to medication. So we're really looking forward to seeing the results of these studies. But I think at the end of the day, what is really important for us as healthcare professionals is to make sure any advice that we give to our patients is personalized to each individual. So we need to discuss with them, to talk about the importance of behavioral change, to discuss about other issues that are happening in their everyday lives. Of course, it's not just about diet. There's so many other things going on. So I really think we need to tailor advice to an individual and their individual needs. And in terms of this precision nutrition aspect, which is discussed a lot in the scientific community, this has to do with whether you could measure, for example, the microbiome of someone and look at their genes or their overall immune system and give them a specific diet which will work just for them. This is a very interesting topic, but we're not there yet in any case. So we should not be recommending these particular diets and these gut microbiome tests as a way of predicting who will respond to a specific diet. So I think the take-home message is that we as dietitians, as healthcare professionals, need to personalize our diet advice based on each individual person and their own needs.
That's great. Thank you very much for that. So something to look forward to maybe in the future that can be more tailored, but also good advice to say, take it into account now and speak to someone about it, because it definitely affects your health for sure, like all of us. That's great. And one more question also for patients. Sometimes it's quite hard to follow specific diets that they're given because just life in general, family, but also the disease and fatigue. Do you have any recommendations or advice for them how to implement something like that in an easy way so they can be followed and followed through for a number of months or even years?
Yeah, and this is an excellent question and is something which is really, really difficult. I mean, I was reading the other day and the number of people in the UK who follow the government's advice to eat your 5 portions of fruit and veg per day is something like less than 20%. So this is an issue which is not just faced by people with rheumatic disorders, but with everyone in the country. So it's difficult to adhere to these dietary recommendations. So it's something which I think is important for global public health. In terms of giving advice to a specific individual, I think the best thing that they can do is speak to a dietitian, because they are the experts and they will be able to provide them with easy tips, easy recommendations on how to better follow a diet. And of course, it's difficult, but having someone there who has the knowledge, I think it would be really beneficial for them, for example, to start gradually introducing some foods in their diet on a gradual basis, and then slowly increasing this variety of foods. But we are aiming for a variable, a healthy diet, and someone who could really, really help with this is a dietitian.
Yeah. Thank you very much. That's very valuable advice. Thank you very much for joining us today for this interview. It was really great to hear from your side. Thank you.
Thank you so much. It's a pleasure. Thanks.
Hopefully, we'll join us again for more videos. We're here at EULA 2026 in London. Thank you very much for watching.